Hello people, top of the day guys. It's good to have you again on my YouTube channel, and today we'll be talking about hemostasis, the control of bleeding, coagulation and even thrombosis. Now let's get started already.
Hello viewers, you're welcome to Dr. Buchi and Purpose channel. Here I create comprehensive, easy to grasp lectures for students and non-students. My lectures are detailed and easy to assimilate. I also share useful academic information, career, job opportunity tips, lifestyle and health talk. If there are topics you want to be discussed here, please do well to mention on regular basis.
The process which controls bleeding at the very site of injury is called hemostasis. Bleeding or blood loss is put to a halt by the formation of blood clots, the gel-like masses that form in the arteries as well as the veins. Blood clot has the ability to stop bleeding, but you know what? They can be formed in the body too when it is not necessary. Blood clot seals the bricks in the blood vessels. Discussing the mechanisms in hemostasis, would be looking at the little cell fragments called platelets and series of clotting factors. They are known as circulating plasma proteins. All these substances always exist in the blood in their inactive forms and are always ready to activate within seconds during or at the time of injury. Blood is typically exposed to components of nearby tissues as soon as blood vessels are damaged. Some of these components take responsibility to bind to and activate platelets. In every step of hemostasis, activated platelets are involved. Initially, what they do is to secrete vital chemicals that induce blood vessels to constrict, and at this point blood loss is reduced. What this is called is vascular spasm, which is narrowing arteries brought about by blood vessel contraction. Do you know that what triggers vascular spasm is local pain receptor and also by elements produced by endothelial cells? Next, these platelets that are activated becomes adhesive to one another and also to endothelium. They clump together to form what is called platelet plug. They secrete elements that then attract surrounding platelets, activating these platelets in a more positive feedback loop. This speeds up the form and propagation of the blood. Next, the site of coagulation is the surface of activated platelets. Now let's talk about the formation of blood clots. A platelet plug reinforced with strands of a protein is clot, and this is known as fibrin. Fibrin is a non-globular protein in blood clot process. It is arranged so very well to fibrous chain. This is the last product of the coagulation cascade. Coagulation primarily is the process where blood from liquid form becomes gel. It is a very complex chain reaction in which one clotting factor activates the next clotting factor in a series of step-by-step pathway. When it comes to coagulation, we have two basic activation pathways. The number one is the extrinsic pathway and the other is the intrinsic pathway. But we don't forget the common pathway. The extrinsic pathway begins with the blood clotting factors exposed to tissue factors right in the extravascular tissue. What induces this pathway are the injuries to the blood vessels. On the other hand, the intrinsic pathway deals with the factors within the blood vessels. It is assumed to serve as a positive feedback loop. It enhances coagulation. The intrinsic and the extrinsic pathway converge into a common pathway and produce thrombin and fibrin. The role of thrombin in the coagulation cascade is essential What thrombin does is that it cleaves soluble fibrinogen to generate insoluble fibrin. It goes on to activate platelets and thus initiates a positive feedback loop, which is vital for the propagation of clots. During wound healing, what happens is that blood clots prevent blood loss, but as soon as there is vessel repair, there must be dissolution in order for blood flow to be restored. Fibrinolysis is the name for this process, which is the cascade. The little cascade that generates plasmin, an enzyme, a serine protease, which dissolves fibrin clot. Do you also know that most of the clotting factors are produced in the liver and that vitamin K is required for their production? Now you know, right? Certain liver disorders like cirrhosis, vitamin K deficiencies can bring about excessive bleeding. However, major bleeding diseases are generated and are brought about by gene mutation that results to deficiency of certain clotting factors. Treatment for them are via replacement therapy with the use of purified factors produced by technologies like recombinant therapy or frozen platelets. Even though blood clot formation is very important to control bleeding, bleeding that is inappropriate is very scary and very dangerous at that and can pose risk. Do you know that far more patients die from unwanted blood clotting than they even die from failure of blood clotting? The first is called thrombosis. Thrombosis is one of the causes of blood arteries present in heart attack, pulmonary embolism, and strokes too. To prevent inappropriate coagulation, there are factors involved, and these are platelets repellent properties of the endothelium, the anticoagulant factors, enzymes that prevent formation of clots, fibrinolysis cascade, which dissolves blood clots at their post-formation stage. Meanwhile, fluidity of blood flow aids in the dilution of little quantity of thrombin formed. The risk of thrombosis is increased or occurs based on reduction of blood flow or stagnation of blood. Drugs that inhibit platelets are administered to people with high risk of unwanted blood clotting issues. We have aspirin as one of them, or drugs that inhibit coagulation like heparin or warfarin. I would like to stop here for today for this particular video. If this video was helpful to you, please consider to share and subscribe. The more the videos are subscribed to, the more videos we produce. Thank you for watching. For now, I'd like to say goodbye.